All right. Good afternoon, everyone. This is Tony Davenport, and I have a client here. We're at Kinetic Touch, and I'm here with a client who has lived with scoliosis most of his life, and he's had complaints of back pain associated. And what I'm doing here to start the session out, we're going to end with rock blading of the tight musculature. So this left side of his back is the more developed muscle. The right side is the lesser developed muscle, and the curvature goes to the right. So for the purposes of this, I'm using a conductive glove. I have an electrode anchored on his lumbar spine across L5 and S1. And I'm going to turn up the intensity, letting him know I'm turning it up, and wait for his response to tell me when we've reached the ceiling of his threshold in terms of what he can tolerate. How's that?
Keep going.
Keep going. Going.
Good.
Good here. Okay, so no matter which device I use, be it my Avasia or my scan arm, it's working at the person's threshold and having the amount of having the program on the device that particularly helps. Well, this one doesn't have programs, but it does have adjustable on the frequency setting. So here, the default on at 90.7 hertz, and all I'm doing is gentle compression with the current running through the length of the paraspinals. And as I get near the neck, I'm fingertipping the trapezius onto levator scapulae and then onto some of the neck muscles, SCM, and some of the scalenes. Now this, at this amplitude, it will make that muscle contract in his neck. So I don't want to yank it too hard. I just want to make sure, sorry, I said yank. It's not, I don't want the muscle to pull or contract too hard to rotate his head while it's in a face cradle, cause him any discomfort. So I'm not going to get too down into the anterior triangle of his neck, but compressing. This is the second round of compressing I've been doing, and I just check in with the right side. And it's laying down the muscle, means I'm flattening out, meaning I am relaxing, meaning I'm taking tension out of the more contracted side. Now, the other facet here too is with my rock blades. When I pick the rock blade up while holding the conductive glove or having the conductive glove running, it puts the current through there, and I actually manipulate the muscle tissue with the rock blade and get the current. Two birds with one stone. I love birds, but not hurting birds. So don't need animal rights after me either. So here we go. I'm gonna stop this, grab the rock blade. So it's important when it comes to the rock blade that we keep the skin moist. So the glove, I've already moisturized the skin with a massage oil. This is one of the dosha oils. And the glove will absorb the oil, but it also changes the sensory of the individual. So changing that sensory is important because it actually gives me a higher amplitude I can run on the device in the safety and comfort of how the client feels the current. So as I lightly start the blading process, now the amplitude he was at was 107 before. With this piece of aluminum in my hand, he's not likely going to make it to 107 because it's conducting and the metal really amplifies it. So right now I'm going to turn it up. So I'm going to hold it still so he can register it. Phil?
Mm-hmm.
Needles?
No.
Just the current?
Just current.
Okay. How we doing?
Good.
Keep going or stay?
Yeah, you can keep going.
Okay. Oh, he's beyond 107. So I was wrong.
Okay.
Good there. So we're at 141. But again, that's when muscles are tight, when there's pain, it blocks sensory. There's another whole explanation for that. We'll get into that later. But now I can literally blade, I'm not contracting the paraspinals that are overdeveloped. I'm relaxing them. I'm sending the current through here. Now, according to the ScanR regime and their paperwork, 90.7, the device defaults on automatically to that frequency because that's their one they use for pain management. That's the best one, best for pain, for most types of pain. There are different types of pain, but as I say, most types of pain it's good for. So if I really want to calm a situation down, typically I will lower the frequency and bring it down to much lower. Now here you can't hear it. We actually have the pulse. My X1 is running. So the pad he's laying on, the whole length of the massage table, is running. And that's helping also create a parasympathetic response through his entire body to relax the whole body. So for the sake of this now, I've lowered the frequency down to the lowest this device can go, which is 15.3. So tissue repair happens according to the paperwork I've read and those other periodicals that may speak of it, between 10 hertz and 100 hertz. So in between these two numbers, a lot of things can happen on the repair and healing side. So keeping in mind that for a brain state, this is also, that's inside the range of one of your brain waves. So a different discussion for a different day. So as I'm blading here, if I stay still, Roger, can you tell me what you feel? Feel the current?
Mm-hmm.
Is it comfortable or can I go up?
You can go up.
So at a lower frequency, I can have a higher amplitude to work at his threshold. Now, if you can look, from my angle, I see the tissue darkening in his complexion, which means I've gotten more blood flow, more increased circulation on this area. And now I'm done with that side. Like the way they taught us in the rod blading classes, if you're bloodshot redding tissue, you're doing it wrong. So here, we want to get good blood flow. We want to free the tissue, the fascia, free the muscle, improve stability at joints, and promote good kinematics and movement. And you move on. You don't stay there and keep damaging and bloodshot tissue. You may hear the 15 hertz tapping on the skin, but it's really, he did say he worked his back out. He did a back workout recently. So this will be good as a good push out any of that pyruvic acid sitting in a tissue, not lactic acid. Lactic acid molecules, as they accumulate, leave the tissue with an oxygen molecule. That's exercise physiology 101. A lot of people tend to forget that, and many people never learn it. So pyruvic acid is the leftover, and that's what's let the gunk sitting in the tissue causing the soreness. So for any scoliosis patient, I'll say this. This hits home for me because my sister, one of my three sisters, in her early 30s, has lived with scoliosis since she was 12, 13 years old. She had the surgery, the bracing, hardware, and yes, we got her an Avasia device for her pain management recently. When I went to visit this year, I used it on her. It calmed her pain down dramatically. It changed her posture, it changed her countenance, it changed her overall just happiness. And so she has it, and she's making good headway with managing her pain. So that being said, this technique on anyone living with scoliosis at any age is ideal. Again, you work at the person's threshold. where they say they feel, in this case would be pins and needles or pin pricks that will irritate the skin, that irritates the nervous system. We don't want that. What we want is good, solid, a buzz, a steady smoothness in the contraction and the microcurrent passing through the tissue to calm everything down, to promote parasympathetic function and keep the excess tension out of the muscle.